Today we are going to know about 10 facts about COVID-19 that will surprise you. COVID-19 vaccine moves to the next stage of human trial. University of Oxford researchers working on a vaccine to protect against coronavirus on Friday confirmed that they are moving to the next level as they begin recruiting over 10,000 people for the second phase of human trials. You may already have been infected, meaning they do not display any symptoms despite having the virus in their systems. Some people never develop symptoms, and some people who had what they thought was a bad cold or the flu may have actually had COVID-19. In the past 10 weeks, more than 40 million people have lost their job. The number of Americans who have lost their jobs in the past 10 weeks soared to more than 40 million as the number of unemployment claims continued to rise, with 2.1 million people filing for unemployment last week. COVID-19 can survive 60 degrees Celsius for an hour. A study has revealed that the novel coronavirus can survive long exposure to high temperatures. The most common protocol for deactivating a virus is the 1 hour 60 degrees Celsius heating, as recommended by the Centers for Disease Control and Prevention (CDC) in the United States. This protocol is used to deactivate viruses with high mortality rates, such as the Ebola virus. COVID-19 can survive up to 5 days. The most important thing to know about coronavirus on surfaces is that they can easily be cleaned with common household disinfectants that will kill the virus. Studies have shown that the COVID-19 virus can survive for up to 72 hours on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. People with type A blood may be more susceptible to infection. In a preliminary study, researchers at the Jiangnan Hospital at Wuhan University examined blood group patterns of 2,173 people who had been diagnosed with COVID-19. They found patients with blood type A had a significantly higher rate of infection and seemed to develop more severe symptoms of the virus. Wearing a mask can prevent spreading the virus. The U.S. Centers for Disease Control recommends that people wear face masks to help prevent spreading the virus to others, since some people who have COVID-19 may not have obvious symptoms of the disease. Authorities caution that wearing a cloth mask or one commonly used for household cleaning or construction is not a sure way to avoid contracting the disease. People with COVID-19 may have digestive symptoms. Cough, fever, and shortness of breath are the most common symptoms of novel coronavirus infection, but many people also experience digestive symptoms, including lack of appetite, diarrhea, vomiting, and abdominal pain. According to a study published in the American Journal of Gastroenterology, 48.5% of 204 people admitted to the hospital with COVID-19 had digestive symptoms. Children or adolescents can be COVID-19 infected. Research indicates that children and adolescents are just as likely to become infected as any other age group and can spread the disease. Evidence to date suggests that children and young adults are less likely to get severe disease, but severe cases can still happen in these age groups. Ventilators and intensive care units are not always needed to treat COVID-19 patients. According to all senior medical practitioners, COVID-19 patients with critical respiratory illness or multi-organ or renal failure are often treated in ICU and ventilators. But not all coronavirus patients require ICU and ventilators.
Thanks for watching. Don't forget to like, comment and subscribe.